Alonso. I'm a professor of epidemiology at Emory University, and I'm the vice chair of the American Heart Association Epidemiology and Lifestyles Scientific Sessions Planning Committee. I'm here today with Dr. Ray, Varun, and Audrey, who are going to be presenting some of their exciting work that they have been doing in India. So Dr. Ray, could you tell us a little about the work you have been doing?
Sure. Good afternoon. I am Dr. Ray, internist affiliated to Tufts University. I am working on a project called Kolkata Schoolteachers Cardiovascular Health. This is based on a non-profit work by Healthy Heart Initiative. We started this project in India because cardiovascular disease has become the #1 cause of death in India since 2017. We studied the school children in urban and rural area. We understood the awareness about the cardiovascular health is very minimum there. So because the cardiovascular disease process, the atherosclerotic process, starts in the second decade of life and it manifests quite long after, 30-40 years later, we thought the students must be aware about the different risk factors and also build up their healthy lifestyle so that we can minimize the burden of cardiovascular disease in India. With a population of 1.3 billion, any country cannot cope with the disease problem unless we'll be careful about the risk factors and minimize the disease burden by adopting healthy lifestyle. American Heart Association has devised some programs, some awareness plan, and some risk assessment plan so that we can make their awareness and also create their risk assessment by providing a risk score by ASCVD model. So this July, we went to India and studied cardiovascular health awareness about 4,000 teachers and also assessing their cardiovascular risk. We enrolled 4,000 teachers, and after assessing their risk, we have made terciles, and depending on that, we have randomly selected 600 teachers among the different terciles and assessing their A1C and lipid profile to make a complete risk assessment. The idea is that the teachers will be aware about their awareness, will be knowing their risk, modify their lifestyle for adopting better health, and also will be conveying that message to the children from year to year so that the school can be used as a platform for conveying the cardiovascular health awareness program from year to year. That way, we build up a better community, better health among the teachers and the students, and will be avoiding much of the cardiovascular burden in India.
Thank you so much, Dr. Ray. Varun, could you tell us a little about yourself and how you got involved in this project?
Of course. Yeah, so I'm Varun. I'm an undergraduate student at Emory University, and I'm studying life sciences and human health. And through my studies, I came to find out about Dr. Ray's project with the cardiovascular health among school teachers. And it was a really interesting project, and I thought it was a really unique angle because cardiovascular health is a huge problem in India, and there's currently not a lot of infrastructure for preventative care. And so I became really interested in what he was doing, so I was able to get connected with him. I was able to get on a phone call with him and just talk with him about some of the work that he was doing in India and in the United States as well. And through that, we came to start discussing the school teacher study that we did last summer. And I was very happy that he invited me to join him and the team to go to Kolkata to do this study. And that's how I got involved with the project. And ever since then, I've been involved with helping with some of the data and stuff like that.
Audrey, could you tell us a little about yourself and what you learned about your involvement in this project?
Yeah, so I'm Audrey. I'm a junior at Hillsdale High School in San Mateo, California. From a young age, I've been interested in cardiovascular disease. My grandmother actually passed away from a heart attack when I was young. And so from a young age, I've been aware of cardiovascular disease. And as I've gotten older, I've wanted to get more aware and more involved in kind of organizing studies and researching about whether there are factors that we can modify to prevent cardiovascular disease. And so from this study, I learned that the awareness with regards to cardiovascular disease is very low in this Kolkata community in India. And so by increasing awareness, especially amongst teachers, we can increase the the awareness amongst the students to which they have an influence over. And by doing this, we can prevent the risk of cardiovascular disease for the next generation in India.
Thank you very much for explaining the concepts about your study, for being here today presenting your abstract, and I encourage you to continue doing this important work.
Thank you very much for inviting us to the American Heart Association meeting. We are proud of the meeting, the presentation, and the volunteer team and Healthy Heart Initiative. Hopefully, we will carry on the project in future.